Before I begin our next story, I want you to picture a scenario. It may be troubling, but stay with me. Imagine you've been listed for an operation. It could be anything, maybe a cataract surgery or a knee replacement. But before you go ahead with the procedure, the doctor tells you to see a psychiatrist. They say you need to pass a psychiatric assessment. Only then will you be cleared for surgery. That's not all. There is a 1 in 5 chance that you will fail this test. So 1 in 5 chance that you will not be getting the surgery that you need. How would you feel about that? This is an impossible situation. You'd probably feel cheated. But for obese patients, this is their reality. Across many hospitals, especially in the US and some European countries, this is standard practice. It applies to candidates for obesity surgery. They have to undergo a psychiatric evaluation. If they pass, surgeons are given a green light to proceed. If they fail, they're denied the surgery. And this happens in 20% of the cases, where life-transforming and possibly life-saving medical surgery is denied to people. This paints a troubling picture. Why is mental state seen as the origin of obesity? How are mental health and obesity linked? Tonight, that's what we'll discuss, but first the basics. What is obesity? It is defined as abnormal or excessive fat accumulation. And obesity is a disease, and it's not just about weight gain. It impacts most body systems: the heart, liver, kidneys, joints, reproductive system. Obesity leads to a range of other diseases like type 2 diabetes, cardiovascular disease, strokes, even cancer. You see, obesity is a complex problem, and it affects more than 1 billion people the world over, across cultures, genders, and age groups. 650 million adults are obese. So are 340 million adolescents and 39 million children, and the numbers keep increasing. Long story short, we are struggling with a global obesity crisis. But there's another crisis that comes with it, a quandary of belief. You see, science has seen huge advances. Despite this, we do not know why some people cannot seem to lose weight, even when they try desperately. It's confusing and frustrating. So we jump to conclusions. We often point to the lack of willpower. Obesity is a disease of the body, but many see it as a disease of the mind, either a consequence of psychological problems or a result of a weak mental state. This belief exists among laypersons just as it does with some health professionals. But there is no credible scientific evidence to prove it. Maybe this belief persists because mental illness is more common in obese people. In fact, it is a fact, mental health and obesity are closely linked, but a person's mental state does not cause them to become obese. It is the other way around. Studies say obesity reduces blood flow to the brain. It increases risk of mental health problems like anxiety, depression, and Alzheimer's. So obesity hurts the brain, but it's not a psychological problem. Yet it is fueled by prejudice and underpinned by myth. So blaming obese individuals or denying them medical care is doing no good. Until this dogma persists, obesity cannot be tackled.